Hi, I'm Dr. Peter Gallagher, and I'm an electrophysiologist at Bryan Heart. I grew up in a medical family, and my dad was a physician and my mom was a nurse. And so I was able to get some perspective of what it would be like to be a doctor. I think as I got into my medical residency, I began to see all the different specialties within internal medicine. And cardiology struck me as one of these fields that bridged a gap between internal medicine and surgery, and that appealed to me. So I grew up in Omaha, Nebraska. I did my medical school at the University of Nebraska, and then did my internal medicine training at the University of Texas Southwestern in Dallas. From there, I did my fellowship at Duke University in both cardiology and electrophysiology. And now I've been in practice for over 20 years. As we look at it now, electrophysiology is a branch of cardiology. And so we have to know all the aspects of cardiology, but then in particular, how does that affect a person's heart rhythm? Sometimes it can be too slow, sometimes it can be too fast, sometimes it can lead to dangerous conditions. I think as we look at arrhythmias for people, it can be a very daunting subject. And a lot of times it can leave people scared. And I think one of our roles, one of our jobs is to look at the entire situation and how does it apply to that person. And in some people, it may be that medications are the appropriate answer. For other people, procedures might be the appropriate answer. It's really important that we listen to people. And that can allow us to adjust how we're going to treat someone on a case-by-case basis. We treat a lot of different heart rhythm abnormalities in electrophysiology. One of the most common arrhythmias that we treat is atrial fibrillation. And I think particularly as the population is getting older, atrial fibrillation is becoming more and more prevalent. And there's a lot we can do to improve the symptoms. There's a lot we can do to improve the safety for people. I think one of the most rewarding aspects of electrophysiology is the fact that we have procedures and devices and even medications that can be curative for people. And to have someone reclaim their life and be able to get back to doing the things that they wanted to be able to do is one of the most gratifying sensations in medicine.